Hi, I'm Dr. Bates, and this is a video series to go along with the post to explain some of the common knee injuries in BJJ. So I'm going to start off with just describing parts of the knee, and then I'm going to actually draw out part of the knee, and we'll go through the MCL, the LCL, we'll talk about the ACL, and then the patellar tendon, and then some of the bursas. So this is the right knee, and this is a model of the right knee. The bones here, this is the tibia, this is the femur, and this is the fibula, or the supporting bone. On the medial side, or the inside of the knee, this is the MCL. On the lateral aspect, or outside of the knee, this is the LCL. And then if we move the patellar tendon and the quad tendon to the side, which has the patella, or the kneecap underneath, we can see that there's these cushions inside of the knee, and this is actually the meniscus. This is the medial and lateral meniscus. And if we bend the knee here, you see that there are these C-shaped cups that kind of make a gasket that helps protect and cushion the knee. So I'm going to go ahead and draw out some of these structures so you can actually see it on a live person here. So first, let's get the patella, or the kneecap, and we'll just do a dots around here. This is the tibia, and the tibia comes up and it's a flat bone right here. So just going along the ridge, the flat aspect of the tibia. We have our femoral condyles, which are here. And a condyle is a rounded structure, so that comes about around like this. So inside here is the joint space. Inside this area is where your meniscus is. So now let's go over to the side. The side here on the inside, the medial aspect, this is your MCL. And your MCL is a very broad and stabilizing structure for the knee. With this model, you see here, this is actually very thin. Looking under ultrasound and working with the MCL is actually wider than this, and it's thicker than this. So the MCL starts this upper condyle here, and it runs down the knee through the joint and connects actually even further distally, or further down. And it has these strong fibers that come all the way through here. So one of the main injuries that jiu-jitsu players get is injuring this MCL, and it can happen from different things. You can have it where you have pressure that's applied to the outside of the knee going inward, and it twists the knee. You can be doing a knee slice, and your foot gets caught as you're trying to disengage, and you actually twist that part of the knee. Sometimes I've seen people get injured with a heel hook, and the femur is stable, the heel is getting twisted, and depending on the direction and the force of the heel hook, the MCL is what ends up getting injured. So let's stop there, and then we're going to go on to the LCL, and we're going to look then at the ACL, which is inside of the knee. So now we're on the outside of the knee, and we're going to look at the LCL. The LCL is a ligament that gets injured, particularly when you're playing something like De La Hiva, maybe if you're doing a lasso guard. What tends to happen is you have a lot of pressure placed on the inside of your knee, particularly when you're trying to snake your foot through, or your foot is fixed and you're getting a lot of pressure placed on the inside of the knee. So imagine you're in guard and someone stands up and they're pushing down on the inside of your knee. That can put a lot of force on the outside of the knee. So with our model here, this is the This again is the tibia, this is the femur, this is the fibula or the supporting bone, and the LCL, the lateral collateral ligament, goes from the head of the fibula up to the lateral femoral condyle. So this is the LCL, and it's really about the thickness of like a number 2 pencil. So if we're to draw that here, what I do is I find the supporting bone, the fibula, and I put my thumb right over it. So here it's right here. So this is going to be the head of the fibula here. And then the way the ligament runs is up to the femoral condyle. So it runs about right here. And it's about that thick as well. So this can be a very annoying injury to have, and most everyone who's played De La Riva for long enough has had this injured. It tends to be sort of an achy pain. It can be sharp at first, but then it tends to linger for a couple weeks, sometimes a couple months. If this is something that's bothering you and preventing you from doing certain positions, it's a good idea to get this treated. Otherwise, it really won't heal if it's been more than a couple months. Next, we're going to talk about the patellar tendon. And we'll go over the patellar tendon and some of the bursa that are in the knee, because that will create more of a sharp pain that occurs when you're on your knees or you're doing certain things like single legs or double leg takedowns. Okay, so now we're going to talk about structures that are in the front of the knee. And with the front of the knee, we have our patellar tendon and then our quadricep tendon. And the patella or the kneecap is right here on under the undersurface. So if I'm going to draw this, I can actually pinch the patellar tendon right here. And this is the patellar tendon here. The quadricep tendon is very big and strong, and that is right here. And so this is where your quad comes down and connects all 4 muscles of your quad. That's why it's called a quad, because it's 4 different muscles. All 4 of those muscles connect with your quadricep tendon, which is joined with the patella and the patellar tendon. So when you're doing a lot of knee work, so for example, we in the wintertime, we go from gi to doing more no gi. I notice that my knees get more tender with the first couple weeks of no gi. And part of that is the patellar tendon itself is getting a little bit more stress from doing work on the knees, but then we're also tending to do more shooting exercises. We're doing single leg takedowns, we're doing double leg takedowns, and so you're having to drop to your knee rather forcefully, and then you're coming around and then coming up. Another area that tends to bother folks is something called a bursa. And what a bursa is a fluid-filled sac that helps to reduce the friction of tendons and ligaments, especially when they rub over a bony surface, because you can get a lot of friction, you can get a lot of heat, and that can actually damage tendons, and it can damage ligaments. So bursas are all around, and you don't notice them until it hurts, until it's inflamed. So you'll have bursas that are in different parts of the knee and around the knee. And oftentimes when you start doing a lot more contact work where your knee touches the ground, if it feels sensitive or feels sharp, oftentimes it's a bursa that's inflamed. Now the good thing about bursas is they respond really well to ice. So as soon as you start to ice the area, it should help calm down the inflammation. Now ideally you're not going to keep pounding on the knee over and over again, because it'll make the bursa inflamed again. So if it does get inflamed, wearing some sort of knee pad or something that protects the knee for the first couple weeks of no gi, or for the first couple weeks that you have something that's bothering the knee, if you think it's a bursa, that can oftentimes be the thing that helps you get over it and helps the bursa to heal. So the last thing we're going to talk about is the ACL. And for that, we're not going to use our model, but we're going to use this one here. Okay, so for the last thing we're going to talk about is the ACL. stands for anterior cruciate ligament, and you hear a lot about the ACL because it's injured in football and soccer and basketball, and unfortunately jiu-jitsu as well. What the ACL is responsible for is it's responsible for making sure that the tibia does not fly away from the femur. It's also responsible for stabilizing the knee when you're doing twisting motions and lateral type motions. So when people injure the ACL, after the swelling goes down, what people usually feel is that their knee is unstable. They feel like they can't trust their knee. And the reason is there's a lot more motion that occurs at the knee joint when the ACL is not stable. Some people don't tear their ACL, they actually strain the ACL or they stretch the ACL. And for those folks, they're lucky in a way that they didn't tear it, but at the same time they have a lot of work to do in order to try to stabilize the knee. I should mention one thing is that when I examine a knee and someone has a knee injury, I think it's really important that you address all of the knee. The ligaments and the tendons, they all work together to help stabilize the knee, and so you can have an old injury in, let's say, your MCL, and because that's loosened, now the entire knee moves more than it should, and that can cause early arthritis, it can cause swelling in the knee, it can cause episodes of discomfort after a hard workout. And so these things can be treated without surgery. The LCL, the MCL, the patellar tendon, the quadricep tendon, and even if the ACL is intact, that can actually be treated too to help shore it up, to help tighten it up, and to help stabilize the knee. So I hope this has helped you to figure out what's going on with your knee. If you do need help, you're always welcome to come in to the office or to contact someone who's involved in sports medicine and understands the different structures and the different dynamics of the knee and how it relates to your jiu-jitsu game. All right, thanks.